So I'd like to welcome you to the 2011 Dartmouth-Hitchcock Nurses Annual Report. Each year we try to highlight the contributions of DH nurses through the annual report, which we publish during National Nurses Week. And so every year, as we highlight our nursing staff, we always want to emphasize the importance of our magnet designation. One of the reasons is that it's very important to us that we have a magnet designation. It highlights the work of our staff to meet the criteria, and we originally met this criteria and now have been redesignated once. In 2007, we were redesignated for a second time. So it's a great accomplishment of our staff to be designated as a magnet organization. In 2011, when I reflected back on the year, I felt as if one of the biggest contributions of our staff and the organization was the go live of EDH. It was a tremendous accomplishment for all of us, and many have said it's not only the highlight of 2011, it's possibly the most significant innovation that we've had in our history as an organization. So when I reflected on our accomplishment of going live with EDH, it struck me that it highlighted how we as a nursing community meet the magnet criteria. So the first element of the magnet criteria is transformational leadership. What intrigued me and really satisfied me as we went live is the leadership that our formal nursing leaders demonstrated, as well as our nursing staff demonstrated. We asked many of our direct care staff to be local support staff during EDH Go Live. They rose to the occasion, and through their contributions, we had a highly successful implementation in our hospital side as well as our ambulatory. It was a tremendous accomplishment for us. The second element of the magnet criteria is structural empowerment. And that is, in the way we've demonstrated this, is really the opportunity that our direct care staff had to contribute to the design of the process. Before we went live, we had many meetings where staff were invited to direct what the workflow would be built into the record, and also to do a process that we called a Stoplight Analysis, where they were asked to demonstrate, is this good enough to go to build, or is this something you want to do differently? Not only the contributions, but the participation of our staff in doing that was wonderful. It was really delightful to see that. So another component of the magnet designation is new knowledge and innovation. And the way we demonstrated this is we had our staff visit other organizations that had implemented EDH. We went to some conferences where the electronic health record had been implemented, and we worked really diligently to have our model and our staff build our record upon what had been demonstrated as successful in other organizations. An additional component of magnet status is empirical outcomes, which is demonstrated by our meeting our quality outcomes. And through EDH, we've actually had our staff pay tremendous attention to the outcomes that we want for our patients and how we document in EDH meeting those outcomes. Interestingly, at our Joint Commission survey visit in December, we had no findings on the inpatient side relative to nursing documentation. It truly is a first for us as an organization and a demonstration of staff's commitment to helping to build the record in a way that let them document the care that they were providing. The fifth element is exemplary professional practice, and this is really around the model of care that we provide. And it was the nurses meeting with us regularly during Go Live. It's really about how you communicate between yourselves. And during Go Live, one of the things that we did is we would have a huddle twice a day where we asked our local support staff and our leaders on the units to come together and have a very interactive, real-time solution and resolution of problems that we saw. And we had such engagement of our staff in coming to the meetings, telling us not only what the issues were, but how they saw they could help to make an improvement or to resolve an issue. So there was tremendous accomplishment on the behalf of our nursing community in EDH, as well as participation. So when I think back to 2011, and the success that we had with that implementation, it truly does demonstrate that we live the magnet principles every day. But more importantly, it demonstrates the tremendous commitment of our staff to our patients and families through how well they have adopted this technology.